Welcome to WKIM Media Network, and we are so excited to have Dr. Dana Cohen, Integrative Functional MD, author of Quench. And we are excited because she has so much to share with us. Um, every month, apparently, they celebrate different aspects of women's health. And for example, October is Breast Cancer Awareness Month. Still, many women's health issues often get overlooked or dismissed by doctors. As women age, many health issues can be overlooked, largely because they go undiscussed. And Dr. Cohen, a respected physician, author, and authority in women's health, is here to help us break the silence on the most important health challenges for women over the age of 40. And she wants men to be an important part of normalizing these discussions. Hello, doctor. How are you?
Hello, I am great. Thank you.
So glad to have you with us.
Me too.
This, yeah. So let's talk about women's health and what should we really be doing? Too often we get caught up in whatever our household says, or our job says, or our kids say, or our spouses say. But how do we take care of ourselves so that everybody in our family or our circle of influence are taken care of?
Uh, it's the age-old thing. You put your mask on first, right before
Mm,
you can help anybody else. And women are the worst at doing that. And so, you know, that you mentioned this just a little bit earlier. The big thing is we need to ask questions, and we need to demand, answers from our doctors, or demand help. And if they can't help you, well, who can I see? Who can I, and I think the most important thing is to speak up, complain when you need to complain. Don't take, oh, it's just normal menopause, you're going through menopause, or watch and wait, as an answer. If you're not feeling good, you need to let people know you're not, the people that are important, your doctor, know that you're not feeling well. And just open this conversation. And you also, the other big thing that we're going to talk about today is that you have to have this conversation with your partner too. We're going to talk about
yeah.
menopause and women's health, and all these things that women are afraid to talk about. And I think we need to let our partners in on it, because we just need to normalize it, right? Hormones are crazy little little chemicals in our bodies that cause, are incredibly powerful things, and cause all kinds of things. And I think the more that our partners know what we're going through and have this conversation, the better it's going to be for our relationships.
And it's also better for our own mental health if we can share it with the people who are in our lives, and we keep stuff so bottled up and, oh, I'm okay, or oh, I got to go do this, or I got to do that, that we really don't deal with what's hurting us inside. How do we break that stigma?
I think just what we're doing right now, just by talking about it, making it normal, making it understandable. It's not, we're not hysterical people. Women are not hysterical. So I think to know that what you're going through is normal. I'm just going to give you such a perfect example, because me and my best friend just discussed this.
Okay.
Urinary incontinence is
Mm,
so common amongst women, and what, even if you've never had a baby, people always think, oh, it's because I've had babies, but if I didn't have a baby, and I still may have a little urinary incontinence, like if you laugh or giggle or cough, and you get a little leakage, it's incredibly common. And men have all kinds of pills available to them for their dribbling and their, and there's not much for women. So I think the more that we talk about it, the more that we demand, then, and there are things that can be done for it. By the way, there are absolutely things that can be done for it. So, but we have to just have a voice, know that it happens to everybody. It can happen to younger women. You don't have to be in menopause to have urinary incontinence, but it is really common, and we need to talk about it.
and we don't talk about it. We don't talk about the reality of what we're going through. And I think sometimes we're so embarrassed. We don't
Yeah.
have this expectation
Yeah.
That's the thing that's frightening.
Yeah. Yeah. And we can't be just if, it's like our periods, like it happens to everybody,
I know, I
like,
hate it.
so, but like, it's life. It's life.
Mhm.
So normalizing it by conversation, I think
Mhm.
is my role in this world. I love the idea. I always wanted to have my office to be like the barber shop of menopause for
I
women,
love it.
where everybody's sitting around talking about their menopause and what they're doing for it. And, uh,
Right.
so that's how I envision my office someday to be.
Oh, and I think it would be wonderful, and people would love it, and, they'll have all the little comfy chairs and all of
Yeah,
that, right?
yeah. Have a
Um,
little soiree and
right. You could
yeah,
drink a little glass of wine every now and
yeah.
then. But here's the thing that's really interesting is that as older women, so I mean, I'm at another point in my life where you see all this white hair coming out. That it, how do I manage that? Because I still am feeling, quote unquote, oh, like I'm ready to change the world. Today I can roll out and go do this and go do that. I mean, and my
I
friends are like, but you're getting older. Yeah, old. I'm old, but I'm going to live this life until I can't anymore. How
yeah.
do we break that silence of pain?
So I mean, that's a tough question. It's a really tough question because I'm not sure. I'm a holistic doctor, so I'm an integrative doctor. So my job is to keep people healthy, minimize their medications. I can almost guess to say that you're probably not on a lot of medications because you are pretty vibrant and youthful, and I think you've probably eat a pretty good diet. I mean, we always go back to basics. Basics are good food, sleep, you know all of the things that we know. Hydration, I wrote a book on hydration. It's everything. Always start there. If you're not hydrating well enough, you're not healthy. So the usual things that we
This
need
is
to.
my Yeti.
I love it. I love it. That makes me so happy.
My huge Yeti. And I go through about, I don't even know, I probably drink about 6 of these a day. It's a
Yeah.
big one, too.
Fabulous. That is incredible. That's so great. Um, and eating real food. We need to get rid of
Yes.
the ultra processed food out of our diets. Eat real food. And we're going back to basics. Those are the things that you need to do to take care of yourself. If you're suffering from things like menopause, like you may be past this already, but for women, most of my women are between that in that perimenopause, menopausal phase. If you're suffering, if you're hot flashing, if you're not sleeping, if you're having joint pain, you need to seek out help, somebody who can help you with those things. And there's hormone replacement for there was a big article in January in the New York Times about that doctors needlessly took all these women off their hormones from the Women's Health Initiative, that it was really misread for all these years. This study
What?
that was, yeah, yeah. And that we should have probably have taken all these people off of their hormones, and that hormones are a definite viable option for women who are suffering from menopausal symptoms. You know,
Hmm.
that's one thing. There are lots of things. There's herbs, there's diet, there's supplements, there's tons of things that we can do to help with the symptoms, and we can gear it towards those symptoms of depending on what it is. If it's, let's go back to the urinary incontinence. If it's vaginal dryness,
Mm.
painful intercourse, if you're getting frequent urinary tract infections because of the vaginal flora that's all messed up, we could do topical estrogen. We could do topical hyaluronic acid, which is a new thing that everybody knows. Most women know you put that on your face. We now have an FDA approved uh, vaginal suppository that is so safe and easy to use for vaginal dryness. And then there's actually procedures. I do a procedure in my office called radio frequency, which is, I mean, these are expensive procedures, typically never
Okay.
covered by insurance, but radio frequency deposits heat,
Mm.
and it helps with vaginal dryness. It helps with urinary incontinence. It even helps with libido. So there's lots of things that can be done if you ask your doctor and ask the right questions and demand answers. And if they don't know, well, ask them, well, where can I go to get these answers? Who can help me?
That's very interesting because you I've had a difficult time trying to deal with doctors who want to tell me what I need to be doing, but they can't hear me when I tell them what I think I should be doing or what I am doing to get to the place where I can understand what's going on. And I've
That's
stopped going. I have to find a new doctor because he wasn't willing to be straight up with me. I'm not 12 years old.
yeah.
And, at 70 something years old, I expect that, talk to me. I'm
Yeah,
not
that's
12.
disheartening. I will say, you just hit on a thing. I feel like one of my strongest points, and I've written this down before about being a doctor, is that I listen. I have
Mm-hmm.
incredible listening skills. I don't know where it comes from, but you just hit it on the nose. My doctor's not listening. He
Yeah,
wants to, I think that you need to find somebody who's going to listen to you. I think it's the single, I think it's the single most important thing that makes me a good doctor. It's not my knowledge. It's my listening skills. I
that's
think that
huge,
is,
though,
yeah, totally, totally. Yeah.
because I don't want to be dismissed or
Yeah.
misunderstood or
Yeah.
ignored. I want a whole conversation. I'm a grown woman. I'm not 12.
Yeah.
And so, you end up in these places. And now I'm in the middle of trying to find a doctor because
Yeah.
I could not have a real conversation with this person. And I was like, you know what? How
Yeah.
about this? You don't have to worry about me coming in here anymore because
May
I
I
have asked
suggest
questions. Hmm?
May I suggest you check out IFM.org, Institute for Functional Medicine.org. It's a group of like-minded doctors. It's a learning institute, and they teach
Okay.
this way of medicine, this holistic, integrative medicine, functional medicine. And you search by your zip code and for doctors in the area that practice this way. And I can almost guarantee you'll find a great doctor that
That
way.
would be great
Yeah.
because the whole issue is that I don't know what I don't know because I'm not a doctor.
Yeah.
Here are things that I do know or things that I don't particularly care about right now, and
Yeah.
I need somebody to help me navigate all of this. And
Yeah.
oh, P.S. Oh, by the way, and if you're dismissive, I don't even want to talk to you. So,
Yeah.
I'm doctorless now, and
Yeah.
and I don't care because I'd rather figure it out down the road than to have I think it's disrespectful.
Yeah, yeah. I also this is such a different conversation that I thought this was going to go to. Um,
So,
d- you know, the whole system is very broken. It is that's really where it comes from. Doctors are given anywhere from 6 to 15 minutes a patient, and it's a problem. I blame it more on the insurance companies than I do on the doctors. Doctors don't go into this because they want to be disrespectful, and it's a problem. I don't, I wish I had the magic wand to fix it, but I think that the functional medicine approach is the approach that you're looking for, and I think it's going to be a really interesting
mm-hmm,
way for you to
mm-hmm. Oh, and I'll keep
experience.
you posted, let you know
Oh,
what's
good,
going on,
good. I would love
because
that.
I think that it's, too often we sit by ourselves trying to figure it out and we have a conversation with our friends, but they're not doctors,
Yeah,
right? I mean, they'll kind of give you, so, oh, well, I've dealt with this person or that person. But the reality is that I want to be able to have somebody that's got the MD behind their name that can have a real conversation with me and can tell me the truth.
yeah,
I just
yeah,
want to know the truth, just the
yeah,
truth, and how to functionally do everything that you're saying that I should be doing.
yeah,
I want to be well. I want to be happy,
yeah,
and I want to have a good doctor that's responsive to me.
yeah, yeah. Well, from what I'm seeing so far, you're doing it right. It's it's your brain is there. You look amazing. I think that the basic stuff, the eating, the sleeping,
Mhm.
the pooping, all of the exercise, all of those things are the simple things that we need to keep pushing and going back to, and the hydration. Hydration is key. I love it. I love that you're hydrating, and not. I have to tell you, most people don't. You know,
You see how big this thing is?
yeah,
Can you see it?
No,
It's
yeah,
huge.
yeah, yeah, I love it.
And I could probably go through about 5 of those a day.
So good. It's so good.
Hmm.
My book is more about eating your hydration though, so getting more getting hydration through eating and vegetables and that kind of thing.
And what's the name
Um,
of the book?
it's called Quench. Um,
Quench?
yes, Quench.
Okay.
It's interesting. It's fun. I think I've helped a lot of people with it, and I think I'm very proud of it. It's good. It's a good book. It's a good read.
Well, and the reality is that we need a good read that's going to help us be better.
Yeah,
And we can't be so dismissive about everything. We have to look at ourselves and be realistic about how important our health really is. It's
hmm,
not a joke,
yeah,
and we've got to deal with that.
yeah,
I have
yeah,
friends that she just stopped seeing her doctor.
yeah.
She wasn't getting
It's
whatever
makes
she
me
felt she
sad.
needed.
It
Yeah.
makes me very sad to hear these things because I don't, I have so many of my friends I went to medical school with, like I said, I think it is, it's hard. It's just really hard. And I can't speak for other doctors. I just can't anymore, but
No,
yeah,
no, you can't. Um, I mean, I understand, but the reality is that we need help,
yeah,
and there should be some collective somewhere with people such as yourself where we can have these conversations a little more openly.
yeah, exactly. Yeah.
So, so what made you decide to become a doctor?
Yeah. Um, It's an interesting story. I don't really know. I think I made the decision when I was 3 years old. And I don't know if it was my mother or my mother's influence saying, oh, you're going to be a doctor. I don't know. But I never wavered. I sort of pronounced it when I was 3, and that was it. Never
I
wavered.
love it.
I knew I would get there someday. Um, and, and I just kept going. So,
Hmm. So think about the women, and too often we're so busy being busy. What is it that we should really be thinking about? We talked about dieting and we talked about exercising, but what should we be doing? Okay, so I'm 71 and I look at I've got another 20, 30 years, right?
yeah,
But what should I be doing in order to maintain the fact that I want to be whole, I want to be well? What should I be doing moving forward to be the best that I can be?
yeah. So, I mean, there's so much. I think we've touched upon a bunch of them right now, but I think one of the biggest things is when you say diet, I subscribe to the no diet approach. Like I do think that diet is deprivation, and but we have no other better word. When I mean diet, I mean what you put into your mouth and what you eat. I think the
Right.
number one thing that we need to do is get rid of ultra processed foods in our diets, right?
Mm.
So eat real food, vegetables, animal protein, fruits, real food, olive oils, minimally processed food. Olive oil is actually a processed food, right? You don't get olive oil. You have to process olives to do that, right? But it's minimally processed. So we want to eat real food. I think that is super, super key. We want to hydrate. We want to sleep well. I do think that screening tests are important. So seeing a doctor every so often. I think by saying I'm not going to go to the doctor, I think blood testing, I like testing. In my
Mm.
practice, I love to test. I love to look at data. I love to see where you are. I test for everything. I look at nutrient levels. Are
Mm.
you getting enough, you know, whatever fish oil? I measure fatty acids in my patients.
Mm.
Not every single person, but I do like to do that. So I like data. Once again, I think finding a functional medicine doctor this is all we do. We look at longevity and vitality and all of these things. So I think this seeing a doctor is important. It still has its place, and getting those screening tests. We screen for cancer. That's what we're screening for. We screen cholesterol for heart disease. That's what we're screening for. So it's important to get to those things earlier and know what they are. Um, those are, it's hard to say. Everybody's individual, right?
Right.
Everybody's so it's hard for me to just give a big blanket say, like, I don't think that every woman should be on hormone replacement. If you're not on hormones and you're 71, I would never put you on hormones.
Hmm.
At that, I think there's a time when it's almost too late to start hormones. But I am a big proponent of hormone replacement therapy in women if they're symptomatic in any way, if their quality of life is affected,
Right.
right? So I think we need to talk. Like, I'd love to talk a little bit about menopause. For you personally, I feel like you're already on the other side, um, uh, meaning in a
What
good
does that
way,
mean? Oh, okay.
in a
Okay.
good way of menopause. Like, you're past your hot flashes. You're past all that. I would hope, you know, yes. Um,
Yes.
but I have women that come to see me who are 52 and just going through menopause and suffering terribly. They can't sleep. They have
Mm.
joint pain. They have a frozen shoulder. They have painful intercourse with their partners that they've had of 25 years. Like, these are things that all of a sudden, it happens quickly. That's what menopause is for women. Here's your hormones. Here's your hormones. All of a sudden, at 50, it drops down that fast.
Wow.
With men, it's different. Their testosterone is a much slower decline over time. But women,
Hmm.
it's fast. And when that happens, many women, not all women, many women don't feel great. And so there are lots of things that we can do for that. There's herbs, there's hormone replacement, there's vitamins, there's diet, there's all these things that we can do to help with menopausal issues. And the whole point of today's things is that also to let your partner know what you're going through. Like, they have to realize that just like when you go into puberty, you're in that puberty stage where your hormones go crazy and you're crazy. The same thing happens when you're in menopause. Like, so
Okay.
they need to understand that, that there are symptoms associated with that.
And those symptoms don't always mean the demise of you. They're just symptoms. And you can work with your doctor to make certain that you're going to be okay. You can't run
Totally.
from all of the information that we think we're receiving because we're not doctors, first of all. And too often, folks are so busy complaining that they're not really going to somebody who can actually help them navigate what
Right.
they should be doing.
Right. I'm curious, do you take supplements?
Nope.
You don't take anything? That's interesting. I'm a huge supplement uh, person. If you saw my desk right in front of me, I have 1,000 supplements here. But I do.
No.
I take a lot of supplements, and I'm a big believer in supplements. But I take them dependent. I look at levels. I prescribe supplements based on deficiencies
Hmm.
or symptoms. So, like, I use supplements in a way that I think is responsible and in a way that they are effective. They're super effective.
Well,
So,
Dr. Cohen, I think where I am, and I'll be 72 come March, and I'm really healthy. And I get up, I literally walk all over Baltimore, all the way down to the water, all the way to the Hamden, all the way. I walk everywhere,
yeah,
and I eat healthy. I'm a big broccoli person. I like lots of broccoli
yeah,
and lots of fruit
yeah.
and vegetables. And so I've decided that I'm going to. I have really cut back where I used to drink wine on a regular basis. I don't even remember the last time I had a bottle of wine, but I'm more about getting the exercise,
Yeah.
about eating and having a good diet. I love vegetables. I love fruits, salmon, and so when I sit down and I look at my health, I'm walking all over everywhere. I'm enjoying my life
Yeah.
with my family,
Yeah.
and I'm not ready to give up.
Yeah.
I don't want to take any pills and all. I don't want to do all that. I
Yeah.
want to just be healthy and do it with vegetables and fruits and fruit juices and things like that. I think that for me, that works.
I love it. And I think you are fortunate. I think you are, you've probably lived this life of good eating and movement. Movement is absolutely key. So you hit upon that I think that is super important. We need to keep moving. Um, that you don't need anything, thank goodness, because I
Thank
think
goodness.
once,
And I'm
yeah,
grateful. Thank you,
yes,
Lord.
yes. Um,
Hmm.
and I also think that, early, earlier in, or what I do, if somebody comes in to see me, we're looking at those, we're being proactive in our health, but looking more at nutrients and nutrient levels, and depending on what we're treating. So if we're treating something, then there's things that I would do, and I always reach towards something natural, whether it be food first, always food first, then supplementation, and then a medication as a last resort.
Hmm.
Um, but I also do want to say, like, sometimes I have to twist my patient's arm if they have a rip roaring infection, and I want to give them an antibiotic.
Oh,
You know. But it goes. But that's not that
but
true. But
but you did
um,
say rip roaring.
yeah. I mean, you have a bad infection. We need to take care of that. So, um, sometimes we have to rely on modern medicine,
Yes.
and so it's important to have your feet in my feet in all courts. Like, I
Hmm.
know
Hmm.
allopathic, regular Western medicine, and my functional medicine training. So.
Well, I know, and like I said, I'm 71. I'll be 72 in March,
Hmm.
and I'm feeling great.
Yeah. Yeah.
Doing what I like to do,
Hmm.
and
Yeah.
having having real conversations about where I am physically, mentally, emotionally. I
Yeah.
think those are all pieces that are huge that we have to
Yeah.
make certain that we're in touch with ourselves.
I think the other thing that I like to sort of talk about is community. Do you have, and I can even say, like, you've created a community by doing what you're doing right now. You're creating a community, right? I think, and purpose, right? What you're doing right now is amazing. Like, you're giving out this information. It's passion for you, and in the meantime, you're creating a community. You're building a community of listeners. But
Yeah.
I think those two things are also important for longevity and vitality, right?
Mhm.
You know, yeah.
I totally agree. It's before COVID and all of that. I was on a local radio station, and as time went on, we didn't work well together. So I said, I can create my own thing, and so I did. I figured out how to do StreamYard and all of whatever else, and now I have a regular weekly show that I can do, and I don't have to put up with all that foolishness. I can do what I need to do.
It's
And
great.
too often we get so caught up in what other people think we can do,
Yeah.
when in fact we can do whatever we want to do. And
Yeah.
as women, we have the ability to bring together other women to be that support system to help you do whatever you need to do. And
Yeah.
I love it. I absolutely love it. I
Yeah.
think that as women, too often we're so busy, meeting the needs from our family and our friends and whatever, that too often we don't spend enough time within ourselves to make certain that we are doing the best that we can do for us individually and our family and our circle of influence, which is really huge.
Yeah. Something that just came up too, trying new things as we're getting older. I think that that's also important. Breaking old habits and just stepping out of our comfort zone. I learned StreamYard. I don't know StreamYard. I think that that's fantastic. I think that that's also what keeps you young. Um, Being willing to go and try new things and step out of our comfort zone. I love that.
Yes,
Yeah.
we have to. I mean, so what's the option, right? What's the option?
Yeah.
Do we really want to just sit and do the same thing and be redundant all day every day, or can we see, well, who we are and where we're going and how to get there, something new. A
Mhm.
friend of mine was running a, I guess running, she was managing this art museum in Baltimore, and it didn't work out for her. And so when you look at all what she went through, the whole mental and emotional experience was difficult for her. And
Mhm.
so one day we just started talking, and I said, the reality is that this is your life and you can build it and shape it any way you want.
Mhm.
We don't have to, nobody gets sent a script that everybody's supposed to read. You don't have to do that. You can create your own, which is what I've done.
I love it.
I'm gonna keep doing what I do because I'm comfortable doing that. And P.S. Oh, by the way, I'm not afraid to fail. So I'm gonna keep on doing until it works out the way I want to. And look
I
at
love
us
it.
today. We're on here chatting.
I love it. I love it. I just love it. So I'd love to talk about more about menopausal
Oh,
issues
yeah.
and stuff. Um, this was what my whole sort of lately what I'm really been interested in. Um, Actually, I'd love to talk about. Can we talk about
You can talk
ST?
about whatever you want to talk
Whatever I
about.
want. All right, let's talk about.
Just talk.
I, I want to talk about HPV. Um,
What's the
H,
HPV?
HPV is human papillomavirus. It is an extraordinarily rampant virus. We almost every single one of us will have been exposed to HPV in our lifetimes. Um, HPV is what causes genital warts, but it's
Hmm.
also what causes cervical cancer. Um,
Oh.
and that's why when you get a PAP, people, uh, your gynecologist may say you have positive HPV,
Hmm.
right? That is the virus that causes cervical cancer, but it also causes other cancers. It can cause throat cancer, it can
Hmm.
cause anal cancer, it can cause vaginal cancer. It's now the reason I'm really excited to talk about HPV is that HPV is strictly it all depends on our immune systems. We talk about aging, we talk about keeping our body healthy. Um, if our immune systems are strong and healthy, we can, most of us, get rid of HPV easily on our own, right? It's those that when our immune system goes amok, that it can then cause cervical cancer or some of the other things, right?
Okay.
Now, um, what do we so as of right now in regular medicine, if you go see your gynecologist and you have a positive HPV test, this is what they tell you: we're going to watch and wait, we're going to repeat it in anywhere from 3, 6, 12 months, and we'll see where we are. And that's it. There's nothing they have to offer you. There's no medication, there's no
Hmm.
antiviral, there's no nothing, when we know that HPV has to do with your immune system. So this is where I just want to say where supplements come in, because we don't have to watch and wait. We want to be proactive in our health. So we talked about a few things. We talked about food. So how do we
Right.
use food as medicine in this situation, right? We want to increase vitamin C. So maybe some citrus fruit. We want to, or maybe some eating some cooked mushrooms. We know
Hmm.
that mushrooms are very immune boosting, right? So having more mushrooms in your diet, cooked mushrooms, can help boost your immunity. But I will say there is a supplement I would like to talk about. It's called AHCC, and it's a medicinal mushroom extract that has been shown to clear HPV faster than without it. So that in and of itself is something that's not. And there's exciting studies. There's human studies that are shown about this medicinal mushroom. If anybody's
Huh.
interested, if anybody knows anybody with HPV, they can look at their website. It's called ahcc.net, and you can look at those studies. Tons of human studies. I also take it like somebody, so this might be something for you to think about. I don't know. Do you get a flu vaccine?
Nope.
No. And I'm fine with that. I'm okay with that. However, flu is pretty contagious, right? There's interesting studies about using AHCC to help prevent flu and cold and flu.
Mm.
So I take mine I religiously over the flu season. I take a little bit of a lower dose than I would if I had HPV. The dose is higher for somebody who has known HPV, but a smaller dose is something you do to help boost your immune system for the cold and flu. Um, so there's food, there's supplementation, and then there's the other things we talked about: de-stress. You know, uh, stress kills.
Yeah.
Stress is bad for your immune system. So if you're diagnosed with HPV, you want to lower your stress. What does that
Mhm.
mean? I don't know what that means for you, but it could
Mhm.
be meditating. It could be talking to a therapist. It could be talking to a friend. It could be going to get a massage. Whatever it is, we have to figure out how to decompress and help treat that stress, because stress is a
Right.
killer. So those are some good, and for any immune system thing, right?
Hmm.
We want to address all of those things: food, supplementation, stress, sleep. That's the other big thing. If you're not sleeping, you're and hydration.
Yeah. And I do sleep. I'm very comfortable sleeping, falling
Yeah,
out. And
sleep is my Achilles tendon. I
yeah.
think, honestly, I think ever since residency, my sleep has never been the same. We used to have to stay up 36 hours in a row, and then you sleep. It's ever since then I never got my sleep back on track. It is definitely my Achilles tendon, and I fight it all the time. I have to constantly you know work on it. I don't take medication for it, but I do take a lot of supplements for it, and they
Mhm.
help.
And that's helpful. And you've got to be able to know what works with you or against you.
Yes.
And I know I have a couple friends that are on diuretics and I don't know what else. And they said, well, how come you're not in? I said, I made a decision a long time ago. I wasn't going to try all these different things. And,
Yeah.
I'm okay. And
Yeah.
until I feel other, I'm going to keep doing this.
I'm knocking on wood.
Yeah. And
Yeah.
then I'll do something different. But right now, I don't need that. And
No.
I think that people have to deal with whatever is important for them and how it works for them. And you have to have a good doctor too, I think, that you can't ignore having assistance since we're not doctors, but to be able to have honest conversations with
Yeah.
people who are aware of what's going on and are that's what they do for a living. So
Yeah.
I can't dismiss that.
Yeah. Yeah. And you can ask your friends too who they see. Do they have recommendations? We can't keep these things a secret. If you have a good doctor, let
Mhm.
let your friends know.
Okay, oh, well,
Yeah.
that is. So tell us so how did you decide that you wanted to become a doctor?
Um, I told you already. So I never, I did at the age of 3. I never wavered. I just
That's
said it
funny.
once. Yeah, I never wavered, and I just that's what I
But what did you see you were little? What did
I
you
don't
see
know.
that you thought,
As long as I can remember, I always said, what are you going to be when you grow up? I'm going to be a doctor. I'm going to be a doctor. I don't know what the impetus was. I don't remember. I just never wavered. Now, I will say, when I was in high school, I was a little bit of a punk rock kid. I had purple hair. I worked in a hair salon,
I love it.
um, and there was a slight time where I was like, maybe I will be a hairdresser. And then I was like, I can't be a hairdresser. I was school came very easily to me. I actually had very good grades, and it just came super easy to me. So I knew that it wasn't what I was going to be, but I thought about it for a minute, and then I just kept going. So
I love it.
uh,
And I
yeah,
think that's huge that you can make those decisions at an early age
yeah.
and have and live in it. Live in that vision that you saw.
I always knew. I mean, I knew I'd get there one way or the other. And by the way, both my parents were not educated. I don't come from a family of educated people. I'm the first in my family to graduate college and go to college and then keep going. And it was never an easy road, um, but but it was just a calling. I don't know how to say. I don't know many doctors who don't go into this unless it's a calling. So
Okay.
that's why I want you guys to be a little easier on your doctors. Um, and it's hard. It's hard when you're not getting what you need for yourself, but you have to understand the system, And just know that if you ask of them in a maybe a different way, that they can help
Hmm.
provide better.
Hmm. But the key is to also have somebody that you can communicate with on a regular basis,
Yeah, yeah,
right?
sure, absolutely.
So give us three things that you think that young people who are now thinking of the future, being a doctor or how they're going to live their life. Can you give us some words of wisdom?
Uh, I'm not sure what you're asking. Words of wisdom to a young person on
Hmm.
what to do, how to age gracefully and
Gracefully,
healthily.
all
Okay,
that. Hmm.
all right. Um, Always, it has to start with hydration. And
Hydration.
yeah, so I'm going to say to you that learning how to hydrate better and properly is the single most important thing you can do
Hmm.
to treat and prevent chronic disease. It is the only thing in my practice that I'm a stickler on, meaning if I give somebody a diet to follow, if you give me 80%, I'm happy, right? If you take 80% of the supplements, I'm happy. Hydration has to be day in and day out. You have to stay on top of it every single day, right? And it's not necessarily about drinking more and more water. Most people
Hmm.
can't drink 5 or 6 of those bottles of water. Some people, it could be 2 glasses of water, as long as you're eating a ton of vegetables to get that hydration in another way, right?
Hmm.
So hydration is always first and foremost. Learn how to hydrate properly. Read my book. It's called Quench. I do think that it's an easy read that lays it all out for you. We have to move. You have to exercise has to be a part of your life. There's no
Yep.
getting around that. But it could be just walking. It doesn't have to be going to a gym and standing on a treadmill for an hour and craziness. It
Yeah.
could just we have to move. We have to move all parts of our body. We have to bend. We have to lift. We have to walk up and down stairs. So movement must and exercise has to be a part of your diet. We talked about whole foods. Get rid of ultra processed foods. Get rid of junk food. That doesn't mean you can never have a dessert in your life, but the truth is, if you make a dessert, it's so much better than buying, packaged desserts that's been sitting on the
Right.
shelf for a week. Even bread, like I'm amazed. My husband, I can't get rid of the bread in my house. Like he just loves, and and so I don't eat the bread. It sits there sometimes for 12 days, and I go and squeeze it, and it's still soft. Something's wrong. Like how can bread stay soft for 12 days? It's not normal. So if you're going to eat bread, I suggest going to the bakery and buying fresh bread or making it yourself.
That's
That's
hilarious.
a better way of doing it. Eating real food, eating real whole food, cooking. We need to oh, young kids today, the best thing we can do is learn how to cook. Nobody knows how to cook anymore. Learn how to roast a chicken. you know learn
Yes.
learn how to make a chicken soup. You have to learn to cook. And that is such a problem. We're getting all this takeout and stuff like that.
Oh,
So
yeah.
teach your children to cook.
I
They will
think that's
be far better
huge.
off for it.
That's huge because
Yeah,
the rest of it is you don't even know what's in there anymore,
yeah. I'm going to say
right?
something. The last thing I want to say, that just because it's we're talking about longevity and things, and create a community, but something we don't do in this country, but they do in every other country in the world, is we need to respect our elders.
Oh,
We need
yeah.
to honor and respect the people that came before us. They have a lot to teach, and we need to learn from them. I mean, we need to respect them. We need to put them on a pedestal and revere them.
Mhm.
Um, so teach your children to do that as well.
Yeah, that respect is huge, and
Mhm.
too often there are communities where there are elders who don't have the support system or
Right.
an infrastructure.
Yeah.
And, a lot of times you can find that assistance in church,
Yeah.
but you've got to find outlets for you and your family because it's
Yeah.
not healthy for them not to have that infrastructure that can be it's love, and that's all people want is love and
Yeah.
kindness.
Yeah. Gosh, you just reminded me of something I'd forgotten about. So many years ago, I had thought about, I wanted to create a non-for-profit in New York, um, about, how there was like Big Brother and Big Sister.
Yeah.
I wanted to create like, I didn't know what to call it, but like the grandmother or the grandparents,
Mhm.
where these kids who don't have anybody, and especially young kids of color,
Yeah.
to have an elder grandmother volunteer to be their grandmother for the once a week, like the Big Brothers, and take
Mhm.
them to a Broadway show, or take them, be a volunteer. And I never followed through with it, but I
That's
loved that
huge.
idea. I know, I
Don't
loved that
dismiss
idea.
it.
I know.
Don't
I thought
dismiss
that was
it.
because kids need their grandparents too,
Yes.
you
Yes.
know, um, and and for those that don't have that because they don't have a family of foster kids, whatever it is, um,
Mhm.
I
And
think that
there are
that would be a
far too many foster children.
yeah. If anybody's
There's,
interested, you could take that idea and run with it.
yes, because I think it's really necessary. We have too many young people who are just in the wilderness,
Yes. Yeah.
really.
Yeah. And I
And
do think that grandparents have a lot, elderly people have so much to offer, so much to teach,
yeah,
so much love to give. And we have, we can't ignore them.
you
We
can't.
have to, they're so viable. And especially now we have more, by the year 2050, something like over 4% of the population is going to be 80 and
Oh,
above. It's a
yeah,
huge, yeah, so
elders.
yeah, so they are a big part of our community, and we need to revere them.
Yeah, and what we're finding here, I'm in Baltimore, we're finding that there are a lot of young people who are working with elders in the Baltimore area,
Yeah,
and finding those communities where they know it's necessary
yeah,
and they're able to support in different manners.
and I
So,
guarantee you, those young people are getting more out of it than
no
even the
question,
elderly people.
no
Yeah,
question, because many
yeah,
of those children need help anyway.
yeah, yeah,
Okay.
yeah.
All right. Thank you so much, Dr. Cohen. We're going to have you back.
Oh, I would love to be back. Thank you. This was really, I didn't know where this was going to go, and it went to a really fun, interesting place. So nice to
Good.
meet you.
Well, we're
Thank you.
here. Yes, it's wonderful meeting you. And feel free. You can come on this platform anytime you want.
Thank you, Marsha. Thank you so
Okay.
much. Have a
Thank
great night.
you. You do the same, Dr. Dana Cohen. Thank you so much. We'll
Thank
see you
you.
soon. Take
Okay.
care.
Be well.
All right. Take care.